The Unfiltered by Jade.
Jade.
Welcome to The Unfiltered by Jade, where we educate, empower, and entertain. Feel free to like, share, subscribe, download, donate, and make everybody know about this.
Beats by RB Records.
Shopping assistance, your style, your budget. Our services include online and local shopping for individuals and businesses, personal shopping, purchasing of company and office supplies, importing and exporting small packages across Jamaica and worldwide, and helping you find unique gifts and items for all events and occasions. Contact us at 876-919-5195 or shoppingassistance2015@gmail.com. Shopping Assistance, your style, your budget.
Welcome back to The Unfiltered by Jade. Today we have with us here Noah Hedaya, and she is a licensed clinical psychologist who works at Whole Heart Reproductive Mental Health, and her specialty is infertility distress. Today, I'm excited. I'm excited to talk to her. We're going to speak about fertility and infertility, and she's here to bring us the information that we need, so others can be educated about this. Hi, Noah.
Hi.
How are you
Nice to be
doing?
here.
Yes.
I'm doing well. Thank you for having me.
Yes. Thank you so much for being here. I want us to jump into this first.
Okay.
First of all, tell us what does fertility mean and what does infertility mean?
Right. So I'll start by saying I think it's easy. Fertility is the ability to reproduce, right?
Mhm.
For the reproductive system to be, functioning. Infertility is a disease of either the male or female reproductive system, which is usually defined by failure to achieve pregnancy after 12 months or more of unprotected sexual intercourse. That's how it's kind of technically defined. And that refers to primary infertility. There's also what is called secondary infertility, which is the ability to achieve pregnancy, or actually I should have also said sustain a pregnancy after having had one child, or at
Okay.
least one child.
Or at least one child. Okay. What are some of the examples of fertility issues with both male and female?
Okay, so I think it's helpful to give a little bit of context first about the different types of infertility that kind of exists out there. And I think this will help understand what, males and females go through. But generally speaking, an infertility diagnosis will fall into three categories: male factor, which relates to failure in the male reproductive system, female factor, and which likewise for the females, and unexplained. About 30% of infertility is caused by female factor, 30 by male factor, and about 30 by unexplained. Okay, so for females, infertility is usually caused by a range of abnormalities to the ovaries, the uterus, the fallopian tubes, or the endocrine system. So the system in our body that produces hormones that, help to either produce eggs or support a pregnancy and so forth. In the male reproductive system, infertility is most commonly caused by problems either of ejection of the semen or compromised semen, which could be described by low levels of sperm, abnormally shaped sperm, or low motility of the sperm, so the sperm doesn't move fast enough.
That's interesting. There's a question that we're gonna ask a little later in terms of infertility, because I mean you had said there's also a percentage of um, issues that cause infertility that's unknown.
Right.
So normally you hear when persons can't conceive, it is, how should I say this? You normally hear that it's the female that has
Right.
the problem.
Yes, that's very true.
Yeah. Nobody really looks at the male to say, hey, you probably are the problem. um, and then nobody looks at the fact that something probably is wrong, but nobody knows what the problem is. So I'm happy that you brought that part out. For this, how does it affect both male and female mentally?
Yeah, well, that's a great big question in the world of infertility. I think you're very right. Infertility has historically been defined and seen as a female problem. In fact, even in the world of psychology, until about the 1980s, there were some out there that believed that you know that infertility could even be caused by a woman's resistance to wanting to have babies, or women's
What?
anxiety, right, around mothering, or having children. Now, while those, certainly in the field in the field of psychology and in medicine, while those ideas have been, proven to be completely erroneous, there's still, there's still a wild held belief that it is the women are to blame. And there are studies that show that, even in this day and age, when a couple goes in and a woman and the couple receives a male factor infertility diagnosis, the woman will still experience just as much, if not more, distress than her male counterpart. So that's a good segue, I guess, to just say that when compared to infertile men, infertile women are much more likely to experience lower levels of self-esteem, life satisfaction,
Yes.
higher levels of depression, anxiety, self blame. They're also more likely to look at a childless or child-free life as unacceptable, to avoid children, pregnant women, and other reminders of the fertile world. Women, infertility over, in a nutshell, it seems to take a higher toll on women than men, and there's a lot of research to support that.
Yeah, because women are more nurturers. And we are generally told as growing up, or even if we're not told, what is being projected on women is that you grow up, you need to have a child.
100%.
So when it is that you grow up and you don't have the child, people look at you like, what's happening? Why you don't have a child? So it almost seems like you're a failure because you don't have a child. It's not a reason of, some of it may not be a reason of, listen, I've tried, it can't happen, or I don't want to have any because it seems unacceptable to not want to have a child. So I understand now why it is that women would not want to be around pregnant women, not probably want to be around kids, and just want to kind of stay by themselves because of how society makes women feel.
Sure, and that what you just described is often described in the psychological world as a sort of double loss for women, right? Because not only are they coping with the loss of the ability to have a child, right? But also with the loss of the support networks and friend circles that they used to associate with, and quite a bit of isolation that often comes for women who are coping with infertility. And I think you also touched on something really important, which is that all, you know, like you said, women are always told you're the, it's your fault, right? They're looked at
Mm-hmm.
as like deviants, or like, what's wrong with you if you don't have a baby? And I think that speaks to the amount of social pressure for women to be defined by motherhood and motherly characteristics. Um, Traditionally, motherhood was considered the most important role a woman could play,
Right.
and failure to fulfill in this role led and still leads to a lot of shame, criticism, and stigma. So, like you said, a long history of societal belief that infertility was caused solely by female. Um,
But it's not.
yeah,
It's not.
exactly.
There are other factors to it.
Right, exactly.
Apart from the types of infertility, what are some of the causes of infertility?
So, that's so some of the causes of infertility. I mean, it can be caused by a number of different factors that contribute to, or can lead to male or female factor. Um, but, so for women, it could be, they could be experiencing, this gets a little bit nitty gritty. I'm not sure if this is exactly where you're going. So you can, redirect me if you'd like, but
That's fine.
things like tubal disorders, like blocked fallopian tubes, which could be caused by an untreated STD, which is sexually transmitted disease,
Mm-hmm.
complications of unsafe abortions, things like postpartum sepsis, or abdominal or pelvic surgery. Uterine disorders like endometriosis, or having even something like benign fibroids in your uterus can contribute to infertility. Disorders of the ovaries, so having like overactive ovaries or polycystic ovaries can contribute to infertilities. And then, like I said, disorders of the endocrine system can cause imbalances in reproductive hormones. So that's for women.
Mm-hmm.
Right. So for male, there could be obstructions in the reproductive tract, which would cause the inability to eject semen. And again, those blockages can also occur from things like injuries or infections to the genital tract.
Mm-hmm.
Men can also suffer from hormonal disorders that lead to abnormalities in levels of testosterone, which regulates sperm production. Any sort of testicular failures to
Mm-hmm.
produce sperm, like um, you know, uh, will impair cancer. Chemotherapy can impair.
Just to name a few. There are a number of them
There are
that
a
can
number of
cause
them,
that.
right? But then there are also another category of things that can impact and are more, fertility, that are more ambiguous, like environmental and lifestyle factors, like smoking, excessive alcohol intake, obesity, environmental pollutants and toxins. Those have all been correlated with higher
In-
infertility rate.
Infertility. Mm-hmm. That's what I figured.
Yeah.
Um,
And I think I'm going to just add this little factoid that there's about 15% of couples in the world experience some level of infertility, and that number has been growing over the last several decades. And there's no significant difference, in spite of what people might imagine, between developing countries and non-developing countries. That's something that often surprises people. They tend to think of infertility as being more of a Western issue that has to do with, in this day and age, women maybe getting pregnant when they're older because they're choosing to have careers and things of that nature. And there's not much evidence to support that that's really at the root
that's
of
at the
the,
root of it.
yeah.
So persons who probably have been trying to have kids for 5 years, 10 years, and are not successful during that time, and probably 12 year they're finally successful. Would that be the 30 something percent that we don't know why they couldn't, but they do it now?
No, I think that the 30% unexplained is really refers to individuals who go for assessment,
Hmm.
right? And they cannot determine there a number of standardized tests, I mean, or standard tests, sorry, standard tests that infertility specialists will administer to males and females. And if nothing is found to be wrong with either the female or the male reproductive systems, that's when people get thrown into the bucket of unexplained infertility.
Okay.
So they can't determine the cause.
So, with that being said, can you become infertile after having children?
Sure, that's what I described as primary infertility.
Right.
So primary infertility is when pregnancy has never been achieved, and secondary infertility is when you've had at least one prior pregnancy.
Okay, so this situation will be secondary then because they've had a child
Yes,
before and then
exactly.
they can't. Okay, awesome. For this then, not to, make it seem anyway, but how much is too much? And as we were speaking, you had suggested something in terms of when is it too late to have kids? So first, how much is too much?
Yeah, I don't. You mean how much is too much in terms
In
of
terms
number?
of kids,
Yeah,
is 50 kids enough? Is that too
you know
much?
that is kind of the space that, generally speaking, I feel it's that really depends on the individual, right? I don't really feel like that is my place to decide or determine for people how many kids is too much for them. I think the
Right.
only time that might come up in my practice is if someone was trying to have kids while knowing that there are, for example, could be severe medical life-threatening complications, to either member, but usually be the woman in the couple.
Right.
That's a situation that you might want to, kind of explore in therapy. Um, but other than that, that doesn't really,
It's not really a big thing.
right. It doesn't really come into, it's not something that really comes up much.
Would have come so much. Okay. When is it too late to have kids?
That's actually a really interesting question that is the topic of some debate in the reproductive world. As reproductive assisted technologies, or the which is a way of referring to the interventions like IVF that are out there. Um, it is possible, right, for couples to conceive at much later ages than they would have been able to without these technologies. And I think one of the oldest live births out there, or the oldest live birth out there, might be a woman close to 60, if not over 60. And
Mm,
there are lots of questions, not so much from the perspective of should she be allowed to or not, but but more from the perspective of the child. What does it mean for a child to be born to older parents whose health might be compromised soon after, whose parents will likely not be there for various developmental,
stage. Mm-hmm.
exactly, stages and milestones. Again, it's complete. I view it, as a personal choice, and people should be free to exercise their choice. But there are certainly questions that are worth seriously considering, that might not be on people's radar.
Right, because at a certain age, you're not able to run up and down with a child. So if you're 60, 65 and you're having a baby, listen, this, just that alone is chaos.
Yeah,
And at that age, are you able to manage?
100%, right? And you look at just statistically, when is your health going to start to potentially become more compromised? And then what will that mean for that child? Will you be able to be there for major milestones in that child's life, like their wedding or their having children? And, it's just important that parents consider those implications and go into it with eyes wide open.
Yeah,
And a plan, right? And a plan.
I agree with that. I
Yeah,
agree with that. So, I mean, people want to have kids at, any age, and nothing's wrong with that. But what we're saying is just try to be considerate of the child,
exactly.
while bringing the child in. Yeah, just try to be a little bit more considerate when having children at such a late stage in life.
Yeah.
How do you prevent infertility, and how can you treat this?
Right. So prevention is a good question, right? I
Hmm.
mean, like the conditions that I've described, there's not much that people can do to prevent them. A lot of them are, conditions that people have no control over. I mean, practicing safe sex is certainly
That's a way to go about it.
right. It's always a good one, right? Because, like I mentioned, sexually transmitted infections can certainly affect your ability, fertility. But there's not that much other than leading, a healthy lifestyle, not smoking, not, excessively consuming alcohol.
And the environment, ensure
Yeah,
environment is good. You're not inhaling certain toxins, etc.
exactly.
And even for PCOS, polycystic ovarian syndrome, you
Yeah.
can also change your diet, because I know people who have gotten pregnant after being diagnosed with polycystic ovarian
Sure.
syndrome.
There are many treatments. In terms of prevention, once
There's not much that we can do
right,
to prevent it, but we
exactly.
can
So
treat. Hmm.
right, but then we can there are lots of treatment options out there for any one of the dysfunctions that I described that I described before.
Hmm. Hmm.
So,
So, so
for example, like blocked tubes, right? You can unblock the tubes. You can find ways to there are ways to access eggs from the ovaries without having, you know, to have functioning tubes,
right.
right? Endometriosis, which is, a disorder of the uterine lining. There are lots of treatment options for women who have endometriosis. So, first they would have to treat the endometriosis, then they would have to, before getting pregnant.
Also, I want to add to
Yeah.
that. What can help? I mean, we can't prevent everything, but what can help is, if it is that we're realizing that there's a problem, we go and seek help. We
Yeah.
need to seek help
A
for
hundred
it,
percent.
because some people have said drinking certain bush tea, etc., can help them to
Yeah.
get pregnant. Seek the professional help.
Right.
Sometimes tea is not enough to
Right.
help you to get pregnant. And sometimes it has to come with major responsibilities in terms of going to seek the help. When you are getting the help, the treatments that they put you on, to be very consistent with it.
Yeah.
If it is that it's diet, change the diet. If it's exercise, because obesity can cause it to, try and exercise, try and do what you need to do in order to achieve what you want.
Absolutely. Yeah, but I think ultimately, it really is important, because, like I said, and especially because, for women, the tendency to blame themselves and to think that infertility is somehow their fault and caused by something they did, when really it is rarely the case.
Mm-hmm.
It is more frequent that infertility is caused by factors that were out of their control, right? And so, in terms of intervention, the risk with interventions that haven't been studied and proven to be effective is that it could cause further or lead to further distress for that woman. So if she's, I don't know, taking something that, or doing something that doesn't have much support behind it, and it
Mm-hmm.
doesn't help her get pregnant, you see how that could lead to a cycle of further self blame, further distress, for, more anxiety, more depression. I think it's really important to consider, to really look at, treatments that have empirical support behind them.
Yes, I agree with that.
And I think that gets to another point that is worth mentioning, is that infertility treatment is incredibly invasive and difficult, and leads to kind of its own world of distress for women.
Yes.
Right. It involves hormone therapy. It involves also sort of invasive, like, assessments, and then afterwards procedures that women incur as opposed to men. There's not that much that they can do to a man's body other than maybe extract sperm, or there, some procedures that also help increase sperm production or the production of healthier sperm. But women are the ones who incur most of the treatment, and it's difficult treatment. Irrespective of who's diagnosed with infertility in the couple.
True. Very, very
that
true.
Treatment is also really expensive and not as accessible across, depending, it's not accessible, certainly, in certain countries in the world, but even in the United States, to certain populations, right? So
it's expensive.
It's expensive. It's not covered by insurance, which it should be. But yeah, so it makes it hard for people in lower socioeconomic strata to get infertility treatment, for single mothers to get infertility treatment, and that is a real injustice.
Yeah, that's a real injustice that needs to change.
Yeah, 100%, 100%.
Yeah, that really does need to change. Noah, where is it that we can find you?
So you can find me at wholeheartmaternalmentalhealth.com.
Mm-hmm.
The group practices whole heart reproductive mental health, and we are based out of Philadelphia. Mm-hmm. Although I am able to practice telehealth in about 30 states, because I have a PSY CAT passport, which gives me the ability to practice telepsychology in all participating state.
Nice. That sounds awesome.
Yeah.
Thank you so much, Noah.
Of course. Thank you. It was a real pleasure.
Yes, definitely. And I've learned a lot from you. I made my notes. So learned a lot from you in regards to fertility and infertility. And we're just employing persons out there to take care of your health, take care of your body. Once you realize that there's a problem, seek medical help. There are different options out there. Research also helps. And you can also visit them at Whole Heart Reproductive Mental Health for different options or different services that they can provide for you.
Mm-hmm.
Right. Thank you so much again. And thank you so much again to our listeners on the Unfiltered by Jade. And we'll be back next week, Tuesday. Thank you. Bam, 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 bam,